This program is brought to you by Teachers College, Columbia University. Please visit us online at itunes.tc.columbia.edu.
Why in this conference are you working so hard? He says, why are you working so hard? I said, because I'm helping Jesus to carry the cross. So I just want you to know that the message was something that personally touched me. Since then, I have become in schools of the Queen Mother and very involved in an African shrine. And I find that it's very easy to integrate the spiritual traditions. I'm about to travel to India and go to temples of Ganesh. So it's about integrating spiritual perspectives. But ultimately, we're one community, and we have to have a consciousness of what affects one affects all. So that we're so grateful that our community includes Harlem Hospital. So without further ado, those who brought to us not only this fantastic community health fair, but are here in this community to continue to provide the very best HIV/AIDS prevention services. So let's thank them in advance for all that they do.
Good afternoon, everyone. I hope you had a wonderful day, and this is Use the mic. Oh, okay. I'll bring it up. We are the last presenters today, and we hope you will find our information useful, helpful, and something that we can share with you at a later date. First, I would like to thank again Reverend Dr. Washington. I think your presentation was so meaningful and timely for all of us. So thank you so much, and you are definitely a hard act to follow, but we will do our best. I'm very, very proud of the work that we do at Harlem, and whenever I have an opportunity to share with members of the Harlem community what Harlem has done in terms of HIV/AIDS care, it's always a pleasure. So I want to start first by introducing the wonderful team that's before you.
And yourself?
Yes. My name again is Debra Williams. I'm the Divisional Administrator for HIV Services at Harlem Hospital. And I will just say briefly that I will date myself when I say this, but I've been at Harlem Hospital for over 23 years. And I'm very proud of the work that I've done. And 20 of those years have been working in the field of HIV and AIDS. Not only primary care, but also counseling and testing, and mostly HIV prevention. And that's some of what we'll talk about today. So on the team, at the left of me is Scott Solomon, and he is our consumer events coordinator, and Scott will tell you later a little bit about what he does. Isabel Casada is our quality control coordinator for rapid testing. And then we have Vanessa Austin, who is the community outreach and education coordinator. And this is an amazing team. I will tell you as we go through this presentation, it takes a team that works almost seamlessly together to make this work easy, to make it almost seem like it's seamless, that you can do almost anything. And they have an amazing way of working together and working with not only the Harlem community, because we expand beyond the Harlem community. So one of the things we wanted to share with you today is some of the work we've done around mobile van testing. I think most of you have heard a lot of the statistics as it relates to HIV and AIDS, so I don't want to go through a lot of that, but what I would like to share is that in New York City alone, there are over 100,000 people who are HIV infected. And what is most profound is that almost a quarter of those individuals are not aware of their status. So if I ask the question today, how many people in this audience know their HIV status, I'm not asking you to raise hands, but I want you to think about that. If you do not know your status, why? And why haven't you decided to move forward to at least complete that test to have that information? Because knowing your status is power. It allows you to make decisions and choices. It allows you to engage the medical setting earlier. It allows you to have access to not only medical care, but also clinical trials and other prevention, counseling, and supports that you would need to not only help you as an individual, but also your family and then your extended family, your community. So that's extremely important. So let me just share with you, and the team will share with you, some of the wonderful work that we do. And one of the things I wanted to share, just to give you some numbers, today you did see we had 3 vans outside. We tested for about, I guess, 5 hours. We tested 52 people. That's the power of community van testing. And for me, I would have loved to see more. And so I want us again to think about this particular model and why some people choose to enter that van and why others walk away. And many of those, again, may not know their status. So that's extremely important. So let me just go through, I just want to go through some of this. I want to talk to you just briefly about Harlem Hospital, just to share with you, for those of you who are not aware, that we offer primary care, supportive services, and they include COBRA, intensive case management, harm reduction, mental health services, family-centered care, women's services, Hep C, screening. We also offer clinical trials, and these services are offered in co-located settings for adults, children, and adolescents. We also have a mom-baby clinic that we're really proud of, that we developed over 10 years ago, where we offer primary care to the mom and the baby. So when the mom is being seen by her ID specialist, the baby will be seen by the pediatrician. And that's an amazing model and extremely successful model. So now early intervention and prevention, and why that's so important. What I'd like to do is to allow Vanessa Austin to just share a little of the work she does. And Vanessa talks about being an education warrior. And I think that's extremely important for us to, in this setting, share this information.
Yes, hi. Recently, we've worked with a lot of big people. Can you hear me now? No. I talk pretty loud.
Or you want to hold this one?
Okay, it's on now? Can you hear me? Okay. Recently, what we discovered was that our numbers are not going down, and going up. So we have to elicit an army of information warriors. So how do we do that? We have to take it to the streets. We have to go where the people are. We've partnered with our faith-based organizations, and I'm so happy to see some of our warriors out there. Because a lot of times when we would approach a faith-based organization, they would say, we don't need that. We're saved. Yeah, you're saved by grace. But you are the people that people listen to. You are the people that have the power of the word. And you can use that word to pass information like this disease has ravished our community. So we've partnered with you guys. We've partnered with other CBOs. We've been on the beach. We've been at the Circle of Sisters. We've been at the Javits Center. We're going to a nightclub. We need to go where the joy is. And you know the joy is in the church. And that's where the people are. The people look for the joy. And we want to take the stigma out of HIV testing. We want to make it normal and routine. So we go to where you are, and we provide the quality service from Harlem Hospital, and we empower the community with the information and their status.
And what I'd like now is for Isabel to just kind of tell you about how we do this work. How do we set up, how could you set up a mobile van operation, you will?
Hi, good afternoon, everyone. In order for us to ensure that we have 100% efficacy in what we're doing, we have to. Hello? In order for us to ensure that we are providing our patients with 100% efficacy in what we do, we must ensure that we are following the quality assurance guidelines of our manufacturers. We currently we are using the oral quick rapid test, which allows us to test oral, finger stick, and venipuncture. We start at base by planning and organizing everything that we need, including the thermometers, the quality controls, so that we can assess our testing location. The first thing we do is to make sure that we monitor the temperature, and we run our quality controls to ensure that our test kits are working properly. And we basically, in order for us to get a flow moving, we have somebody doing assessments and just one person doing all the swabbing and resulting the tests as we go along.
And if you're wondering what staffing is required for such an operation, often what we will do is have not only the counselors available, but also case managers in the event that we discover a preliminary positive. And the question for many, and I will tell you, this was a question that our executive director repeatedly asked me, was, Debra, what are you going to do in the community if you find someone who's HIV positive? You have to assure me that this person will be safe and we can manage this process. Our executive director is a psychologist, by the way. So Dr. Palmer was extremely thoughtful of that process. So what we've been able to do is to ensure that we have a case manager available. We would escort the patient or the consumer to the hospital if necessary. We would provide a hotline number if they needed additional counseling and assistance. And one of the other things that we've done where we find it to be most powerful is that we also have peer educators that are available. So we have individuals who are positive, who work on our team, and are available to meet with individuals when they are testing on the van and have a very different dialogue with them. So I'd like Escott to just talk a little bit about that process, please, Escott.
Hi, good afternoon. My name is Scott Solomon. I'm consumer event. I might type, I don't know if it changes. I'm consumer events or consumer involvement coordinator for the Harlem Family Center. And primarily, well, I do outreach, and as far as the consumer involvement events coordination, we have over 1,000 HIV positive patients, clients, consumers at Harlem Hospital. And a lot of them, are shut in because, once you get tagged with the stigma and the, the HIV, thing, you're not going out the house, you're not going out, you're not doing anything anymore. So we do a lot of trips. We do a lot of bowling, boat rides, and things like that, because you wouldn't believe how shut in the people be. Also, before I talk about what Ms. Williams wanted to mention, you guys, is that we also have a PEDS clinic, and one thing we try to do is that, now, just a real brief history, the PEDS clinic, these people are born with HIV. So when they turn 18, they have to leave the PEDS clinic and go to the adult clinic. They don't want to leave that clinic. So what we've done is take them on trips, like we're going to a Broadway play on the 18th. So now they'll go on the trip with other adults who are positive. So now, when they have to leave the clinic, if they see an adult, maybe they've seen them on the trip, and they're not as, like not that feel that bad about going to the trip. Real brief history, I've been HIV positive for 19 years. And my God did not strike me. I am not a bad person. That's right. I just want to share my story because however you got it, you got it. But I never used IV drugs. I'm a heterosexual man. I was in college playing football. Well, I knew I shouldn't be trying to sleep with everybody, but I was a college football player. This is what college football players do. This is what we did. We had a big house across the street from the dorm. I go to class late at 12 o'clock, go to football practice, come home, do my homework, we drink, do the same thing the next day. This is what we do, and this is what they do in college. Trust me, now. And like Ms. Williams was saying, I have met some very caring, loving individuals. Like, they're on this panel right now. And Ms. Williams is one, Isabel and my co-worker, she'll kill me, Vanessa. Right. But, we found something, 'cause I do a lot of work in the community too, I've had some loving, caring doctors, and you can look in my eyes, and I got family that love me to death, still to this day. But it's nothing like looking in somebody's eyes, and I know what you're going through. That's why we employ peers. See, because we can use a peer, and always when we try to go out, we don't have it all the time. And I don't have to disclose all the time, but sometimes I do, because if you have a tough time, you just got diagnosed with HIV, you need, it would help if I could tell you, look, hey, 19 years. I got 19 years. I got a full-time job. It's not a death sentence. I don't want to, but see, now I don't want to mistake it either. It's not okay. That's the message we got to keep putting out too. That medicine might not work for you. Because, there's some other stuff going around in our community, and people are like, well, there's medicine now, so it ain't no big deal. That medicine might not work for you. So you gotta, you have to remember. So we use peers, we have peers. I'm not a peer, I'm a full-time staff, but we still employ me too for someone that tests positive. Like we said, if you want to, we will take you to the hospital on that day if it's open. But we'll use me, because I have no problem with disclosing. Because of my family and my friends, I'm okay with it. Because I feel like that's going to help erase some of the stigma. The more we talk about it, the more churches talk about it, thank you, Reverend, the more people talk about it. Because I'm going through changes, so I'll be 50 in September. Right? so you people who remember this now, remember this, but the guys in here who up there with me, and I'm a little bit of a history buff. Remember cancer, when we first talk about cancer, if I touch you, you get cancer.
That's right.
God striking you. Remember that was, Pete, if you're not old enough to remember that, that's how the whole country and the world thought.
That's right.
It's not like that anymore. We understand. We got educated. So this is why I have no problem with healing. I will keep beating on the stigma, because we have to get past that. Like I said, I don't feel like I did nothing wrong. Oh my God, or I did anything wrong, or my God, man, my God's a loving, caring God. I don't know why. I'm not even questioning it why. I'm in the field, and I do what I do. You have to like what you do to be in this field. And thank you so much, because you're right, it's about people participating. Because one thing I want to say about outreach, me and Vanessa was talking about it this morning on the way here. If you want us, or you want anybody to do outreach, you have to know that nothing never goes the way it's planned. Nothing never goes the way it's planned. Cars are blocking the street, one van not working. I don't know if you guys noticed outside we had the Harlem Hospital van. That's our old van. We have brand new vans. These of them would start. But what do we do? Me and Vanessa said, oh well, we use the old van. You have to roll with it. That's how outreach is. Things happen. Like we go through my quality control. You would be surprised the quality control we go through before we test. We talking about testing the kids every day. If I work in 2-degree weather, 100-degree weather, I am not exaggerating. Outside the Lincoln Projects, 100-degree weather, if the heat gets too hot in the van, we have to stop. We cannot test the kids at a certain level. So, it's just a lot to outreach, but you have to love it. And, I don't even question anymore. I do what I do because, well, to be honest with you, I can't say that. I was kind of like plucked. Somebody plucked me, you need to start doing some more work. So that's kind of how I got more involved. I've been involved in community level before I was working for the hospital. So that's kind of, I can go on forever, they know that. So that's how I'll stop there.
Are you surprised? No, and please know that I asked him to come up on the stage 10 minutes before we began. So he is not prepared at all. Sorry. Okay, so I think what we wanted to share was that there are many ways that we can engage consumers. There are so many people out there that are still. Is that good? There are so many people that we need to engage. There are foot soldiers, warriors yet to be engaged, that we need to empower our community to make a difference. We need to move from fear to hope, to empower our children, looking at that concept of each one teach one, that if I share information with you, then that empowers you to then share with others. This is extremely important for us as we move into the 28th year of the epidemic. When you think about the fact that the epidemic was first identified in 1981, and we still have issues of stigma and fear, and we still have a problem of individuals not going in for care. We still have issues of disclosure. Part of the reason people are not disclosing are some of what Scott talked about. How will my community embrace me once they find out? The fear of losing friends, family, that still exists to this day. We have individuals that will engage in relationships and will not disclose for the fear of the consequences as a result of their disclosure. So we still have so much more work yet to do. So we empower all of you. Now you have the information. You can now be the warriors. You can join us, as Dr. Wallace embraced Harlem Hospital about 2 years ago and said, come on, let's be partners. Now we can be partners. Reverend Washington, now we have that relationship, and we should fortify that relationship so that next year we can say that there are some amazing things that we have done with the faith-based and the hospital setting, and what a powerful force we are now. So we will open for questions if you have any questions, and thank you so much. It is late in the day, but we felt that this was important information to share with you. So thank you.
My name is Nana Krantima, and I'd like to first thank you all for the great work that you are doing. I come every year to the conference, and I see how I really like the setting this year, Dr. Wallace. Instead of them being downstairs, that they were in Everett Lounge. You know, it was bright in there, and you know, the vibe was just really right in there. And I just applaud you for your work. My question is, do you go out of state to do this?
We haven't yet. We've been asked to go into boroughs that are not a part of our catchment, and we have gone, and we've done some work. We've received calls, requests, from Westchester, Philadelphia has asked us to come out.
Is it a possibility that you could actually respond positively to that request, is what I'm asking?
Definitely.
Thank you very much.
You're welcome.
Hello. My question is, what has the hospital put in place for us to deal with, one, our young people under 18, and two, our older men that Viagra is causing them to become infected? What two things are in play?
You want to start?
Yes.
Well, let me just say one thing. I'm not sure if you know this. At Harlem Hospital, we have an amazing doctor, Dr. Danko, who works with the adolescents.
Yes.
He runs, I think there are 4 clinic sessions, and he has such an amazing relationship with his kids that almost 100% of them who have shared with him that they're engaging in sexual relationships actually test. I mean, it's amazing. I think Ashley is going to be going to the adolescent clinic to work with Dr. Danko. Ashley just joined us at Harlem Hospital. And so we wanted to have younger people involved in the process. So we're really excited about that initiative. With respect to the older adults, we have a staff person in our medicine clinic, and we've really paid very close attention to the medicine clinic, because that tends to be where the larger percent of our patients are. And thirdly, Escott will be joining the urology clinic. So he will be the male counselor working in urology.
Also,
They come out.
yes.
So-
Yes, we do. We do. We have, just this week, we have initiatives with youth. We're having a youth forum on top of the Magic Johnson Theater, in the hip hop artist spot. And we're inviting leaders from 6 different youth groups to start an initiative called Get a Grip. Girls Empowerment Teams Achieving Greater Resources and Prevention. And the youth are going to create their own PSAs, judge the PSAs, edit them, slice them together, and be able to show them in schools across the city. So these are videos going to be prepared by youth for youth. And we go to schools, we do health fairs in schools. We went to high school last week, and we did a health fair for them, and we educated the youth. And we go wherever we're invited, we'll go. Also with the senior centers, we see a series of seniors. We go to the cities. Harlem Hospital has a fabulous outreach and education department, and they all go to all the senior centers in the area, and HIV is invited, and we go along. And we test the seniors, and we counsel the seniors, and the seniors are having sex too. So they get the same education and prevention. You know, we just have to tailor different messages for different people, but you should hear some of the stories of the seniors.
And I think it's also important just to know that you mentioned the ages, that we have from children, from infancy, and our oldest was in, I believe, 88-year-old
Yes.
woman,
Yes.
who I will admit, when I walked into the counselor suite that day, I assumed she was sitting there waiting for her grandchild. I had no clue that she was there for her results. So that was very powerful.
Is that the one who said she got from the young whippersnapper who said
Yeah.
it too?
Yes.
I want to repeat something I said about, and talk to her about the adolescents. You know, I've tested for like 15 years now, and you know, I speak, you know, I do education updates to that, and what I found out, this is what they told me, they didn't see the carnage. You know, I was in a support group in the 80s, but in the early 90s, but everybody in the group is dead, except for me. So see, they didn't see the carnage. So they don't know how bad it is. So I repeat what I said, because I heard this in Philadelphia, and everybody wasn't happy with it, but I will repeat it, and it's really hard, because I do a lot of work in the community, but it's hard because I do work for HAC, Harlem Hospital Corporation, Harlem Hospital. But, like I said, not that you will die, but if the medicine don't work, you will die. But we have to put that message back out there, because it's real. You know, people are still dying, but the younger generation didn't see that. Because they don't know that. They see a person like me and like, oh, you lived in 19 years. You don't, no, it ain't that easy. I have, like I said, I was in a sport group where everybody dead except for me. See, they don't know that. They just see me and like, well, look at him, he's back, he's doing okay. I could take a risk. So I think we have to reestablish the story and not forget our history. No, I didn't even realize this, but this is worse than the plague. Right. This epidemic has been worse than the plague. More people died in this from the plague.
Good afternoon. My name is Minister Morgan. I'm from the New Mount Zion Baptist Church. Your information up there said you have HIV clinical trials. My first question is, how does one enroll in the clinical trial? And do you have also clinical trials for Hep C?
Oh, good question. For the clinical trials, we have clinical trials for adults at Harlem now, and the patients really should come through the Harlem Hospital. It's the Family Care Center. So if you know of anyone who's interested, we can get you in contact with that individual. And we have several protocols that are offered and available to our patients. Not only at Harlem Hospital, but also at our Renaissance Healthcare Network. We have sites at Lincoln Hospital, Metropolitan Hospital, and St. Vincent's Hospital. For Hep C, I believe there is a clinical trial they're looking at right now. If you give me your information, I will let you know when it becomes available. We had a lot of discussion about that particular protocol in the most recent CAB meeting that we had. So I'm not really sure if that has finally, if everything has been signed off for that particular protocol. And one other comment I wanted to make about some of the initiatives. Next week is Women's and Girls HIV Awareness, and at Harlem Hospital on Monday, put this on your calendar, it's one night only, okay, from 4 to 7, we will have an evening clinic for partners. And what's I think so amazing is that our director of the Infectious Diseases Department, Dr. Mannheimer, and our director of the Family Center, Dr. Allow, will both be medical providers there. And we will offer rapid testing, STI, that's sexually transmitted infection testing as well.
And I want to mention something about clinical trials. This is a national problem. It's the mindset of African Americans, and I'm not saying it's right or wrong, but because of Tuskegee, we do not want to get involved in clinical trials, and that means we don't know how the medicine works on African Americans all the time. If the medicine works differently, because we still have that fear that we want to be experimenting on. I know what happened in Tuskegee. I also know there was black physicians and black nurses involved.
Right.
I also know people got paid. But the thing is, we all know people do things wrong, but now the clinical trials have to go through so many safeguards. They even have to come present at the hospital. They come present a clinical trial they want to do, and y'all see how I am. You know I'm grilling. I got 1,000 questions. So, it's a lot of safeguards. We have to get involved in that because other communities go do the trials. But we don't. Now we don't know how the medicine works for us. So our mindset on a lot of things just have to kind of change.
Now, the testing is free, but once a person's been diagnosed,
Yes.
and we know that we're trying to get the health care bill passed through because many folk don't have health care.
Yes.
How are they handled if they test that positive? How, because I know there's costs. You can't do it all for free.
No, we have, we have case managers available, and we now have several plans that patients would have access to. We have ADAP, we have Metro Plus, which is a Medicaid managed care plan, and then we also have, in some ways we're resource rich, I shouldn't say that given the economy now, but we have programs tailored for the uninsured. So I share that to say that if a patient is found to be positive, we are providing care regardless of the ability to pay. Very important, very important. Okay, thank you. That's it? Oh, you got your people there?
It was great news.
Yes,
I'm happy.
yes. Thank you. Any other questions? Thank you so much.
Okay, we actually have 14 minutes. So, spirit's moving you. Go ahead.
Oh, Dr. Wallace.
You for now,
Okay.
First of all, I think your testimony, and God has sent you here for a reason, to be able to share with the attitude that you have, and to be able to grill people when they want to come and use people as guinea pigs. I thank God for you. My question to you is that you mentioned about the people who shut down once they find out that they do have this virus and they lock themselves in the home. Do you have any suggestions or ideas that you would like to put in place as far as to reaching out to those people, to some kind of way that to because the ones that's diagnosed and that's willing to go for treatment, okay, they're getting help. But what about the ones that find out about it and then shut themselves down? What happens to them? Who's going to cry out for them? So is there some kind of plan that you?
Well, okay, now, just for a moment, I don't work for Harlem Hospital.
Just for a moment.
Just for 5 minutes, I don't work for Harlem Hospital. But there's organizations that we do what we can do called selective social. Matter of fact, we're having a party on the 28th. We have a little educational update, and I got somebody to pay for it. I didn't know that this was such a widespread problem, but I went to a party a couple of weeks ago, and I met some people who hadn't been out in years. And I'm shocked. What are you doing? You go home, you go to work. So we've had to take it upon ourselves, because see, I don't blame people for not disclosing. You know, I got a good story about, there was a mother, they had me come speak at the clinic, right? The adolescence clinic, and there was a mother. She said, well, Scott, I can't come out and protest with you or come to one of your meetings because, I'm like, well, why not? Because she's a real outgoing grandmother type. Because she said, you know how kids are. If they see her with me, they're going to immediately accuse her son, be he is or not, of being positive. So see, I understand that. I understand the disclosure, because there are still some, you will not believe, this is in 2009. Somebody told me last week, a grandmother, the son won't let her see her granddaughter. What? Is she go sleep with the grandkid? How she gonna give him? But that's the ignorance. You know, so there is still a lot. This is why I don't mind disclosure. This is why, and the whole community don't agree with it. This is why I want routine testing. I want everybody. And the whole community doesn't agree with this, but I want everybody. You walk in your doctor's office, I want you to get tested. See, now it'll start getting some of that stigma out of the way. Like I said, if you look at your history, a lot of things were stigmatized, but as we kept going and as we got educated, you know, and we used to talk about something before that they don't talk about it anymore. Everybody in here is more dangerous to me than I am to them. I mean, my immune system is pretty good, but you're more dangerous to me. You give me something I can't get rid of. All I can give you is HIV. And on top of that, I didn't want this, but on top of that, I see a doctor every month. How many people said in here? I know what's wrong with me. I'm HIV positive. That's it. That's it. My blood pressure good, my sugar good. I see a doctor every month. That's right. Before, it wasn't like that. I'm African man, and that's the thing about the men that I deal with in the street. And I don't knock them for this because I dealt with it. And you guys know, and of course, there's always more women in here than men. I go through it, works out, I sit and meet with 14 women. But you know how we do, and I'm a little better than now. You know your husband and boyfriend we're not going to the doctor unless we have this. We'll sit there and be dying, and y'all be like, will you go? Will you go? But see, I'm not knocking them because I identify. I was a college football player. You know, how was I going to get sick? And I always thought, and these are not original ideas, I always thought that it was important because African American men and men, you know, don't want to talk about this. Because men talk about this, you're going, oh, you're going to think I'm gay. So I thought it was really important to let men know. You know, I've been accused of being gay, but it don't bother me. I think I'm manly, so you know. So it's okay, so I can talk about it. I'm not worried about being accused of gay. I thought it was real important, but somebody, you know, somebody told me it was important to let the women know that you could look at a man and look at me, all right, my car outside the hospital, I got a full-time job. I ain't using drugs or nothing. I'll have a beer tonight sometime. You can't tell. You can't look at somebody and tell. How would you know unless I revealed it to you? 19 years. All I got is a little stomach. I think it's the medicine. But I'll be 50 years old and I don't work out anymore. People like, you know, I don't, you know, so this is important for me to share with my sisters, not my sisters, with women. Everybody. You cannot look at somebody. I still play basketball on Saturday nights. I still got a little game. Well, I can't go tonight, but yeah, I play sometimes.
Okay. Good afternoon. This is not so much of a question, but my name is Linda Fleming, and I founded an agency in 1994, Children and Parents with AIDS. It's an early permanency planning organization. Reverend Washington has been with me since the founding of this agency. I'm basically here speaking on behalf of the CBOs, the community-based organizations. We have the HIV, Central Harlem HIV/AIDS Network, with about 50 or more nonprofits involved. With Children and Parents with AIDS, the agency that I founded is a guardianship agency where we find homes for children whose parents will eventually be demised because of this virus. However, recently we put a new program in place for at-risk youth who have maxed out of the home. The parents have been deceased, and what happens to these children. So we put a program in place where it's prevention for poverty and incarceration. We are concerned about the young people. We want to make sure that they are tested, that they have a future, and they have a planned future, life skills in place to help them, whereas they lack in their younger years. But I just wanted to make that known to you guys about children and parents with AIDS COPA. In fact, we do have a linkage agreement with Harlem Hospital. We have a linkage agreement with Metropolitan, St. Vincent's, you know, so we've been in place for about 14 years now. Thank you.
Thank you.
All right, as a health student, and I guess first I want to commend you and say thank you for the work that you're doing. As a health student who works with adolescents, I think that education is key. And, you know, the notion of having education warriors is vital to not only solving but stopping and preventing this disease. But one thing that I do know is that information isn't enough.
Mm-hmm.
I, as a health educator, am telling these adolescents what the risk that they're putting themselves, you know, at, and all this other stuff, and giving them statistics, and they know the information. But I guess I'm wondering thoughts from you who practice in the community, if you have any thoughts about sort of the multidisciplinary things that they deal with. I work with a high schooler who, you know, she was pregnant with her second child, and we're talking about the risk of HIV, etc. But when she was telling about her background, I was like, you know, what I'm telling her, she's weighing sort of the risk benefits of her life, the love that she doesn't receive, the self-respect that she doesn't feel, and the challenges of, you know, being the oldest of, I don't know, I think something like 15 kids, and she's the one who has to help provide for them. And so the activities that she's engaged in are more important to her in terms of feeling loved than, you know, the possibility of putting herself at risk for a future that she doesn't even necessarily believe in or see for herself. And so, in addition to the education, do you have any thoughts of what other activities or anything else that helps reinforce this message?
Well, what we find is when we're in the community testing, it's most helpful to listen. That clinical listening. Because if you let them, the young people telling you their story, point out their own risk, start developing a plan for them, a very informed person plan for themselves. You kind of give them a homework. You know, when you're doing that risk assessment, they say, oh, and I do this. Oh, and I had 15 boyfriends already, and I'm 13. Oh, and I like to do these acts, and I feel powerful. And then they hear themselves. There's a lot of times when they don't even realize it until they hear themselves say it out of their mouth. And they have that private time with that person who's not their parent, or not looking at them, judging them, or not saying, oh my God, you did? You know, it's that clinical silence that makes all the difference in the world. Just having someone to pour their heart out to and start developing that plan to take care of themselves and letting them know they're precious and they mean something. And they mean something to you, a perfect stranger. And they need to mean something to themselves.
I also have been able to what we do, every opportunity I get, and what I do also, and there are more out there than you think, and we have access to them, is bring out adolescents who are positive to speak, because they have powerful messages. Because sometimes, you know, whatever, they make me feel, I start talking to them, and they look at me like, oh, this guy, you know what I mean? But no, because they say things, and sometimes I be like, what they meant, you know, but I bring out, you know, I go get my people. I go get my 24-year-olds and my 21-year-olds, and I let them talk. You know, I'll bring them and let them talk, because then, you know, or women, somebody they could identify with, because they don't seem to identify with me. I tell them, you know, I've seen all these people die. I tell them, I was in the support group, everybody died, they were like, yeah. But when I bring out the teens their age, it seems to be a little more effective.
There are a group of young teenagers that in the churches that believe that they're practicing abstinence because they're not having Gentile to Gentile sex. Have you ever planned to kind of reach them, because they seem to believe that the only way they're going to actually get AIDS is through that method, and because they feel that's they're virgins, they're not, because they're doing other things. Okay, do you have a plan on how to reach them?
Yeah, we address that every time we do an assessment, every single person, not only the youth, but the seniors, the adults. A lot of people have the myths, and that's one of the things we do when we do HIV testing. It's not just empowering you with your status, it's empowering you with the information. How can you contract this disease? How can you prevent yourself from getting it? We ask them, what's your risk? Do you have sex orally, anally, vaginally, and use of toys? A lot of people don't know when you're a child, you can share your toys. When you're an adult, you can't share your toys. You can get a disease. We're talking about STDs, and we're talking about how STDs increases your risk for HIV. We dispel, I've heard myths that the boy wears his boxers, I can't get anything. If I drink a cap of bleach, I can't get anything. That's one of the most powerful things that we do when we're doing testing in the community. We're dispelling myths, and we're turning that person around who was full of those lies and turning them on to the truth.
And do you have teenagers that are willing to come to speak to teenagers?
Yeah, we have last
because they don't. Some of them really don't believe. Like he said, they believe that you're older, and that's where you're coming.
We had a teenager last year who they were called deep fashion divas, divinely inspired, virally affected teenagers, and they did a fashion show for 50 teens. It was a beautiful fashion show with music and food. What the teens didn't know, that I was going to be there to do an HIV presentation and to test them. And we asked the question, who in here is sexy? Everybody raised their hand and said, oh, I guess everybody's tested.
and there goes the problem with, there goes the other side of the coin as far as, I do want everyone to be tested, part of your routine testing, your routine hospital visit, but now, are the providers, is a doctor going to give you the pre-test counseling we give you? See, when we give you that pre-test counseling, we hear all that stuff. You would not believe the story right here. You would, I can't get it if I mean, I can just go on and on. It's some unbelievable stories, you know. But when we give you that pre-test counseling, we can break the myth. Because, you know, like I said, I've been in this field for 20 years, right? Now, I understand the transmission factor between men, right? But I just want to ask everybody a question, well, I don't know if she's going to give you this. I want to ask everybody a question real quick. Is this a gay disease?
No. Is it
a gay disease? No. So why are we talking about men having sex with men? Why are we even having the discussion? Are you having sex? I don't care what you having it with. You're at risk. You're at risk if you're having a relationship with somebody and they're not you and them. That's all I want to hear. I don't care who you having it with. If you're having it, you're at risk. I don't even want to get into all that other stuff.
Hello, I have a question. Like, I know it's about HIV, but when I used to go to Dr. Doncourt, he's very good with adolescents, and I used to feel like, oh, you know what, you could take this test, my test can come back negative, but what do you do? How do you, she led the way, how do you tell people, like you said, listen, let them listen to themselves, but what about those that just feel like, how I used to think, oh, my test negative, I can still go out and do the same thing that I do. Do you have more workshops for those?
Yeah, I think there are a couple of ideas we've come up with. One is to have a series of focus groups with adolescents to have them help us design other models. Because again, this is one of the questions that our executive director brought up the other day. He said, Debra, you have to come up with something quick and catchy. And let's figure out a way to do that to just kind of bring them in. So one of the things we do, and we love the use of focus groups, to bring people together to talk about a common issue, and then how can we best design models to work with the larger audience. Thank you so much for all of your interest.
How young can you be to be tested without parent?
Yeah. You know what's interesting? The only time your parent has to be involved is when you come in for care. So you can come in and be treated, but if you come in and you're 13 and you require medical care, then your parent has to sign for you. Yeah. Yes. Thank you.
Okay, I'd like to propose a marriage that involves multiple partners. Sounds sexy, huh?
It does. It does.
And so, if you were in the audience earlier, you heard about the HIV/AIDS Peer Education Training Manual. But to make it very simple, what it's supposed to result in is basically a theatrical troupe that travels around the community and educates. So if we take everything that we've heard, we're talking about the young people from the church, perhaps people just like you, who get together with other adolescents, and and the group makes up the skits. It could be a common scenario. Oh girl, I just take my cap of bleach and I'm okay. I got my man. And then the skit includes a peer, such as yourself, saying, oh, come on, you haven't heard? And it's funny and it's hilarious. My vision for that manual, if you saw the movie Sarafina, how many saw that? The play, the movie? That is the vision. Can you imagine the creativity and the songs and the theatrical skits that could be so compelling that somebody's saying, oh, come on, we need to get that on YouTube. We need to have that on the internet. We need to have DVDs of that particular play or of those skits in every single high school. And that every health class has devoted 20 minutes or 40 minutes or however long it is, and that auditoriums and school auditoriums are also opportunities for these live skits and the questions and answers. So I would propose a marriage between New Mount Zion, Harlem Hospital, and the research fellows, because right now we don't have the money necessarily for sure to send Sharon to Kenya this summer. But the idea is there's an epidemic raging in this community. And so what can we do? So I would hope that we could come together this time next year and that we can show you a DVD of a skit that has involved 6, 12 adolescents from New Mount Zion or peers from your community, from Harlem Hospital, and that we blow the audience away because of the power of a marriage involving multiple partners. Sexy. I want to thank all of you for staying today. I hope that you have received something that will allow you to take action and to have an enduring commitment to moving our local, national, and global communities toward equity and health for all. Let's give ourselves a hand. Thank you.
The preceding program was brought to you by Teachers College, Columbia University. Please visit us online at itunes.tc.columbia.edu.